Healthcare, and we are looking over our budget recommendations to appropriations. And thank you to Joint Fiscal for working late into the evening and putting this all together for us. We had ranked our priorities yesterday, and the reveal is big reveal. So I just wanted everyone to be able to see this. Any questions anyone might have. So it appears as though number one, in base funding, we have recommended that FQHC's Medicaid rate is increased. And then second,
Is it on here? Are those, yes.
Yes.
Could you tell me where?
Just refresh.
We have to refresh it.
One second.
home health rate increase is second.
Here, okay.
Vermont Care Partners request for provider rate increase for our DAs and SSAs is number three. Bridges to Health, number four. That's been changed to base, even though this year 675, 900 in the base going forward. And then tied for number
Yes. There's a tie.
a tie for number five, increase the family planning codes that Planned Parenthood New England uses, along with the sexual assault nurse examiner program. And then subsequently, and we're gonna put all of the requests that we had on here. Put them back on the spreadsheet before we send it to appropriations. We just won't have them ranked at all. Six is the fee schedule adjustment for inflation, the RBRBS fee schedule.
By the way, we don't have any numbers for this, and I don't know that you want to ask appropriations for something we don't know. I don't know how we get that number.
I believe because the reason there was a report. Wasn't there a report with recommendations? Because this was in the budget last year requesting that Diva.
There was a report, actually.
Yeah, I'm wondering if there were numbers in that.
Mary, didn't you have numbers down for that, the MSP?
No, this is not.
Sorry.
This is RBRD.
Number seven,
Oh, sorry.
okay, so should we? Let's talk about this. There aren't really any numbers affiliated with this, so are we asking appropriations to just do this as language without having any money attached to it? Or is this something that we should encourage in another venue at another time? Any thoughts from any members?
I guess I'm wondering, but
Yeah.
well, there are two sevens, so I didn't know if that was just a typo or what.
No.
No,
they were
they're ties.
So then. Quimby and police consensus program, on my thing are both seven.
Yes,
They're
they're tied.
Oh, it's both.
Yes.
Got it. I was just wondering about putting that down at the end with language that we support this, but we don't know the money yet. As our last recommendation.
We could do that.
Yeah, or if we can find the number between now and.
I think we should provide a number.
Yeah.
That would be ideal, but I would not like to lose it.
I'm in my spreadsheet. Can you help me? The economic index inflation did. I mean, I have a bunch of numbers here. Is it population health? Is it?
No, it's just basically raising the RBRVS fee schedule.
Oh, yeah,
I think
there
that-
is a zero there. They didn't get.
Yeah, I think that I'm being told from around the room that they can get us those numbers.
Oh, okay.
Okay. Or they'll try. Okay, so we'll keep it in there, need numbers. MSP Medicare Savings Program came in number 7. I'm sorry. I'm sad about that. And Medical Student Incentive Scholarship tied for 7. On to our one-times, the request that was made from VMS and others, which is what I'm kind of considering the other bridge funding.
Can someone scroll somewhere?
Oh, yeah.
Time.
So where was it?
Down or up.
We trans,
One
I'm trying to
time.
see the one time.
oh, you want to get to work on that?
Sash for All pilot. The continuation of the mental health integration through, which was kind of through the blueprint. It was a pilot program and it included Dulce. Number 3, and the family medicine residency program 4. And do we have, oh, that's all. That's all general fund dollars, isn't it? I'm sorry, it's okay. The emergency service providers, is number 5.
Here's another one without money.
Can I,
Although that one had the money, it was unclear if it was,
I have a question about this next one. This is really, this line item is essentially, isn't it a combination of all the other? So like on the side, we have the 1.6, the 3.78, 2. That's the one, that's in the governor's recommendation. Then we have this 14.6, isn't that what we have as our priority number 1, along with this is not a separate line item.
No, but her testimony, she was saying that they were not in there, but she was gonna follow up with us after testimony with that written. I never saw that come in. Did anybody see follow up from Monica Ogilvy's?
No. I would have noticed her name.
Yeah, I didn't see it come
She
in.
said they give you a question. She said it.
Monica Ogilvy.
I'm more looking at it in terms of our spreadsheet, not the numbers. I think that we already have, this is a duplication.
For the one up top, yeah.
With the 2 up top. All right, we'll clean this up.
The question was the gap.
Yes,
At the end of that sentence was the gap. And that's what never got addressed.
which is what she was explaining in testimony.
Okay, or the dental health through SASH. The wellness visits through SASH. The American Heart Association's request regarding cardiac emergency response in schools, and the request from the Office of Professional Regulation, Secretary of State's office to support their one FTE to streamline the mental health licensing process. These are the things that received votes. We're gonna add back in all the other items. And does anyone have any concerns about this and what we're sending? We're also gonna send a letter. Do we have that?
I mean, I have it formatted for it.
Okay. Should we read it, do you think? And get people's thoughts on it?
hopefully it still needs some. So it's those highlights filled in, and I think it, refers to top five based on what time priorities and get more than that, so I just need some updates on what the numbers are, but otherwise.
We'll help you through it.
Um, So I'll just ask, is there general? Does everybody approve of sending these recommendations to appropriations?
I got a second.
Go ahead.
So these are all the ones that are had votes. And you just mentioned putting the whole list in, and I'm wondering about that because I don't know if appropriations reads that entire list. What does that do or help with? I just want to understand that.
I think the letter that we will be sending will address that. As in previous years, we've ranked our highest priorities, knowing fiscal restraint is needed in FY 26. We only prioritized our top 5 base and one-time. This has left several requests not prioritized yet. They are vital to the health of Vermonters, such as funding for Planned Parenthood and continuation of SASH expansions. We strongly urge the Committee on Appropriations to support all of our priorities and the other requests that would extend current programs. By doing so, we will be supporting a continuum of care that is vital to the sustainability of our healthcare system, most importantly to the health of Vermonters. So having them on the list says we acknowledge that these are,
We heard this.
yeah.
And here's our top 5.
And here's our top 5.
I like the idea of the top 5 rather than top 10, but I don't want to, I mean, you would know, what do you, I mean, what makes it more likely for us to get our top 5? If we include that, or who cares?
Make Woody go down and talk to him.
No, I'm not talking about his role in appropriations, I know, yeah, but favorably received.
Maybe how you're sent to me
In person.
in person. I mean, you're gonna be doing that anyways. So how you put across your appeals to them,
This is less relevant than that.
I think so. But they'll have something that they can refer back to.
Yeah.
Basically,
Take notes on.
and then provide them, sorry.
Yeah.
Appendix.
Yeah.
That makes sense. Now we can add them all in, it's a letter, so here's the top 5.
So we'll
And then
take,
here's the sheet we worked on.
Hold on, I don't know that we're putting the top 5 into the letter. I think they're still on the spreadsheet, but they're gonna be the only ones that are numbered and everything else is not going to have a number.
yes,
They want to do it?
yeah,
So that's what I served.
yes. So we will take everything, we will put everything in the one time and into the base. We will put the top 5 on the top of each of them, and we will number them 1 through 5. And we will have the other things listed, and we will indicate in the letter the importance of all of this to our healthcare system. Is everybody in agreement of that?
Yes.
Is anybody not in agreement?
Yes, go ahead.
So
Noel.
in the sheet, we're just gonna add everything back in, and anything below 7, 5, we're just gonna have them.
Yep,
Okay, I can do that.
thank you.
That might take me, what time do you need my?
12:30,
I can do that.
okay. Or before, sometime early this afternoon.
Okay. And then you want me to add up the costs? She wants everything. That's all I have.
Okay, I'm just gonna do a straw poll on this. He is not, and I have been advised by the clerk's office that when we take a straw poll,
Oh, yeah.
if somebody is not available, that they can still request, they can vote at another time.
How much later?
There's no rules because straw polls are not actually official polls.
Right.
And I have spoken with Lori and she's unable to make it here. And she indicated that she is a yes on what we were proposing to do. So I'll ask for everyone in agreement with sending these recommendations to appropriations. Please raise your hand. Okay, so we're gonna go 10-01,
A question.
and we'll ask Brian.
Yeah, when do we see the letter?
We will send that around as the moment it's completed.
Thank you.
And I probably won't be sending this to appropriations until this afternoon. If anyone has any concerns about the letter, then we can discuss
Circle
it.
back, yeah.
Circle back. Okay,
Very good. Thank you very much for that process. Yay. How about that? Everybody, thank you.
we need to take a 5-minute break. I know we